Hello, and welcome to Your Health, Wealth, and Happiness. I'm your host, Brittany Maxwell. No one plans to get sick or injured, but when you are, healthcare plans can give you the most affordable way to get the treatment you need. Especially as our age increases, so does our risk for illness and disease, making it even more necessary that we continue to take care of ourselves. On our last episode, we covered some of the most important information about Medicaid. Today we have Jason Hollister from WellCare to discuss Medicare. WellCare is a group that provides healthcare services through government programs. Thank you for joining us here today, Jason. We're so glad to have you on the show.
Thanks for having me on the show, Brittany.
I'm sure our audience will be excited to know more about Medicare. I find it extremely important to be well informed about this topic because as we're growing older, we are going to face more and more medical conditions, and not everyone's financially stable and able to afford these type of expenses.
Right, you're right on with saying that it's very important to stay well informed for our patients and for everybody in general. One of the main things, especially in today's climate, expenses can be overwhelming for people. So especially for seniors that are on a fixed income or don't have any kind of income at all. So that's kind of why I'm here today, just to help people out with those concerns.
So before we get into specifics about what WellCare can offer patients, we should probably talk about what Medicare is exactly. And if you could tell us a little bit more about what the program is, who can be offered it, and who's eligible.
First of all, Medicare is a federal health insurance program. It offers, to qualify for Medicare, a patient has to be 65 years or older, or they have to have some type of disability that would qualify them. So, for example, for a disability for someone to qualify for that, they have to have the disability for 24 consecutive months. Disability like ALS or end-stage renal disease, something along those lines. And patients would be covered for that.
Okay. It sounds like Medicare offers a lot of great benefits to their patients, and I think it can be very useful information for those who are under the age of 65. Eventually, we do all age, right?
Exactly.
So could you tell us a little bit further about the benefits people can expect with Medicare, specifically with WellCare?
So for WellCare, one of the main benefits is that you don't have to pay any kind of premium. And on most of our plans, there's no deductible for that. And you have many other services that go above and beyond what typical original fee-for-service Medicare would offer, such as dental, vision, hearing, prescriptions. They also get an over-the-counter benefit program where they can pick things through a catalog, such as toothbrushes, different over-the-counter items, cold medicine, things of that nature.
It sounds like WellCare truly has a lot of benefits that are great for their patients. So, can you tell us about the healthcare options we have today, and what are some of the benefits people signing up with Medicare can receive in the marketplace?
So typically with Medicare, there's 4 parts of Medicare. There's Part A, Part B, Part C, and Part D. So Part A of Medicare is your hospital insurance. When you go into the hospital, those kind of concerns it covers. It also covers skilled nursing facilities, nursing homes, things of that nature. Part B is your thing that you would use when you go to see your doctor. Any kind of like durable medical equipment, things of that nature. So whenever you have to go see your primary care physician, you would use that. Part D is prescription drugs. So any kind of prescriptions that you need, that part of the program would cover. And Part C is Medicare Advantage, which WellCare is a program. And we offer additional services that go above and beyond what Medicare has to offer. Because Medicare typically will only cover about 80% of your healthcare needs, and we cover that other 20% and kind of go above and beyond with a lot of the different services that we have, like dental, vision, hearing, prescriptions, the transportation that you were talking about.
Can you please tell us what type of plans are offered through WellCare specifically, and those who are seeking it, what kind of coverage they'll receive?
Okay, so for WellCare in the Buffalo area, there's primary 5 different plans that people can get. The first of our plans is our core plans, just anybody that's eligible for Medicare, which is 65 years or older. So those plans in the Buffalo area would be our value plan and our essential plan. And what they're designed to do is to actually help the people that are 65 years or older with their Medicare to kind of go above and beyond the 80% of what they would cover. So we cover that other 20%. The other plans that we have in the area are designed for people that have Medicaid and Medicare. And those plans, we have two of those plans that are in this area called Access and Liberty, depending on what level of Medicaid they have. Sometimes people will have partial Medicaid, and sometimes people have full Medicaid benefits. And it depends on where they fall, how we can help them out. But a lot of times Medicaid will pay for most of their medical needs, but our program goes above and beyond. We offer that over-the-counter drug program where they have a catalog where they can pick many of the items that we're talking about: vitamins, toothbrushes, toothpaste, Band-Aids, a whole wide variety of items that they can pick. And they also get transportation as well. And the last plan that we have is our Advantage plan. And that is a plan that does not have prescription drugs on it. So it's for people mainly, a big population is the veterans population, because they go to the VA for most of their prescription needs, and they won't need that Part D because they get everything. They like going to the VA, so they get most of their prescriptions and everything through the VA hospital. So that program is specifically designed for them, and they also get a second option to go in case they don't want to go to the VA. They have a second option they can utilize.
That's really good. I know we have a big VA population around here, so
Exactly.
So that's really great to have. And that was a really great explanation. We're going to take a short break, and when we come back, we'll continue our conversation with Jason Hollister about WellCare and Medicare. Welcome back. At the beginning of the segment, you had talked about how WellCare creates plans for people with limited incomes and how they make it more affordable for seniors. You even spoke about how some of the programs even offer no premiums. Can you tell us, is Medicare affordable, and how with WellCare?
Yes, for most income levels, it's going to be definitely affordable for anybody that has Medicare with a WellCare plan, because all of our plans are at zero premium, so nothing's coming out of someone's pocket for our plan. In addition to that, they're not paying any copay when they go to the doctor either, so they're going to save a lot of money when it comes to that, because a lot of times there's a lot of money that's left on the table when people do choose a different plan, or because sometimes people might have a supplement and they're paying a higher premium every single month. So ours is tailored towards anybody that has that limited income, to kind of give them another option to go to that, hey, I can afford this, I can get coverage. So that's kind of like why we go out into the community as much as we do to try to spread awareness about our program. In addition to that, when they have Medicare, Part A and Part B, Part A doesn't cost anything. Part B, there is a premium that comes along with that people pay out of their Social Security checks. But for underneath the WellCare program, they're not going to have to incur any kind of additional costs.
I think that will definitely put a lot of members' minds at ease, knowing that they can visit their PCP when they need it. So, now that we know a little bit more about Medicare, can you please tell us how and when we can sign up for this?
Okay, so Medicare, the main enrollment period for Medicare is October 15th to December 7th. And that's called our annual enrollment period. However, most of the year, it falls underneath a different period called the lock-in period. Now, the lock-in period is a time frame where people can only enroll unless they have a special election period. Now, special election periods include things like moving from a different place into a new area. Say if someone moved from Florida to Buffalo. Also, if people have the state pharmaceutical program called EPIC in New York State, they can enroll in the program. Or if they have Medicaid, that's another way someone can enroll all year round into the program. There's a lot of different special election periods, so it's always best for someone to reach out to one of our benefits consultants, or we can contact them if they allow us to, and we can go over those special election periods to see if they qualify for the program.
Okay. And with those special election programs, is there any particular things that they need to know going in when they're wanting to change their plan to be with WellCare?
So the main thing to know when you're going to meet with one of our benefits consultants is we go over everything very thoroughly with everybody. We explain all about Medicare, all the different parts when we sit with someone. And part of that is going over the special election periods that are available to someone. So we would work with them to see if there's a right fit, if they can enroll during this time, or if they have to wait until the annual enrollment period.
I think that's really going to help a lot of people feel more confident in making a decision to switch with WellCare and
Right.
Medicare. Yeah. Well, I have one final question for you. When people are with Medicare and they have their red, white, and blue card, do they lose that when they switch to a WellCare plan?
So someone never loses their Medicare when they enroll with WellCare. They still keep that red, white, and blue card, so they never have to worry about losing that. They always have their Medicare coverage. In fact, it's needed to be part of the WellCare program. However, when they go to see their primary care physician, they would show their WellCare card, and they wouldn't show their Medicare card because they would be a member with WellCare. So all they have to do is show that card, and they'd be all set when they go to the doctor.
So they just better make sure that they have it in their pocket when they go.
Exactly. Always good thing to have. Always good thing to have.
Well, I want to thank you, Jason, for all this extremely useful information that you provided us here today regarding Medicare with WellCare.
Thanks again for having me. I'm glad I could help out, answer some questions, and hopefully that'll be a help to the people.
I think it definitely will be. As we get older, we shouldn't have to be afraid that we won't have medical coverage when we need it most. It's comforting to know that when the time comes, Medicare and WellCare are both on our side, going above and beyond, working to make sure that we are taken care of. I want to thank you, Jason Hollister from WellCare Health Plans, for being here again with us today to discuss Medicare.
Thanks again. I appreciate you having me on, and I hope I helped out with some of the questions and answers here today.
I definitely think some of our viewers will find this very relevant, as I did here today. Until next time, stay healthy, happy, and live better.